This episode of the Great Girlfriends podcast is being brought to you by Healthy Women and the Allergen Foundation. For more information, please visit yourhealthybreast.org. Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and everything in between. I'm your host, Sibylla Muti. Hey, Great Girlfriends. Happy Wednesday. My, oh my, what a wonderful day it is. Yes. Listen, we've got a ton of things to talk about, including the recent election. So much is happening in our country, in our culture. Great Girlfriends, just know that we are covering you personally and professionally in prayer, and we're sending love and lots of positive energy your way for the days and the years ahead. And in saying that, I'm asking you to prioritize your mental health. Your mental health includes prioritizing your physical health, really getting back to your body as a temple, as a place of refuge and a place of peace and comfort and ease. I am so happy to have partnered with Healthy Women to really fuel some important conversations about our health and our wellness. One of those important conversations is about breast health. And this one is being led by an extraordinary doctor, Dr. Minkin, who has joined me today to help facilitate what is a much needed truth-telling segment, I will call this, on breast health for us. So I'm asking you to grab your pen and paper, call a great girlfriend, tell her, hey, go to the website, greatgirlfriends.com, and listen into this important conversation, and then write a lovely iTunes review, because that is how other great girlfriends are able to plug into the podcast. Lastly, join us on November 9th. We're having a really exciting Kickstarter workshop online, so it doesn't matter what country you're in right now, you can still be there with us. Go to bit.ly/ReadySet2020. Be a part of this experience. It's November 9th, 7 to 9 p.m. I am so excited to mastermind with all of you in preparation for what can be an exciting close to 2020 and an even more exciting beginning to 2021. So let's jump right into this week's episode. Enjoy.
Great girlfriends, you are in for a treat. I feel I'm for a total treat. And I always love sharing all of these amazing guests that I get to meet with my partnership through Healthy Women. So I want to shout out healthywomen.org and the Allergen Foundation for bringing Dr. Mary Jane Minkin to the podcast today. Hi, Dr. Minkin. How are you?
Sybil, I'm just fine. How are you?
I am nowhere near as busy and as resourceful and useful as you are. As I've been reading over your bio, my goodness, what a woman.
I don't think so. It's just fun. That's all.
I love this. Are you okay with me reading a bit of your bio?
Oh, thank you, Liz. I said, sure, it's okay.
I always feel like when a woman has earned and worked so hard as you have in medicine, that it's only fair that I just share with our audience a little bit about who you are. So I'm just going to go right in. So Dr. Minkin is clinical professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the Yale University School of Medicine, and has been in private practice in New Haven, Connecticut for more than 35 years. Wow. Dr. Minkin is board certified in obstetrics and gynecology, and she practices at Yale New Haven Hospital. She earned her medical degree from Yale Medical School and her undergraduate degree from Brown University. She did both her internship and residency at Yale New Haven Hospital, the former in internal medicine, the latter in obstetrics and gynecology. She is a fellow of the American Congress of Obstetricians and Gynecologists and has been a North American Menopause Society certified menopause practitioner since 2002. Dr. Minkin has been the director of Sexuality, Intimacy, and Menopause Clinic in the Division of Gynecological Oncology in the Smilow Cancer Center at the Yale New Haven Hospital since 2008. She has been the director of the Yale OB-GYN Society since its inception in 2006. She serves on numerous committees, notably for more than 25 years as faculty representative of the Department of OB-GYN on the Yale New Haven Hospital Pharmacy and Therapeutics Committee, on the Yale Infection Control Committee, and on the Yale Antibiotic Drug Utilization Committee. She also serves on the Residency Selection Committee, and she's the founder of MadameOvary.com. What a fun name for an incredible resourceful site for women. Dr. Minkin, we're in great hands today. Oh my goodness.
Well, Sybil, you're too kind. Thank you very much.
So there's a lot I want to know from you, obviously. I mean, what you have, Dr. Minkin, in my audience is a host of women from around the world who are passionate about wellness. They're passionate about doing their best to optimize their health and their personal care. And they really want to know what's true and what's false and how to be better advocates for themselves. So I want to jump into breast health. It's such a sensitive topic for so many women. As we know, breast cancer is one of those things that is a really taboo and uncomfortable topic for a lot of women in our community. But we know that early prevention and detection can save, lives, and it can give us a leg up and create advantages for us. So I first want to get into, before we even go into the cancer side of things, I want to talk breast health and what is the number one factor that we as women need to know or have in our pockets as we navigate our breast health journey.
Okay. Well, it's a very interesting question. And I know it sounds sort of crazy, but it's actually complex. The key thing is that a lot of women assume that breast pain equates with breast cancer. So when women are concerned because they have some breast discomfort and stuff like that, they're like, oh my God, I must have breast cancer. I'm going to die. Okay. And the thing is that fortunately or unfortunately, breast cancer doesn't usually come with breast pain. If it did, it would be a better thing. It would be an announcement. Hey, I'm here. Come and get me. But it doesn't. And so the first thing that I would strongly encourage our listeners to say, hey, if you got sore breasts, let's talk about it, but don't panic. That's the most important thing. Don't panic. It's probably going to turn out to be not breast cancer and a lot of other things going on. And then, of course, we want to talk about breast cancer, too, because that's a very important topic that we talk about for health and lifespan. So as far as breast pain, a most common cause that women get once we start having periods, that our ovaries are working on a regular basis, is what we call fibrocystic breast changes, or what I call in a non-scientific term, lumpy, bumpy breasts. That's what it is. And a lot of us have it. And when I examine women, and we look even these days at mammogram reports and stuff like that, probably a good half of women have significant fibrocystic breast changes. And that's what tends to give people the discomfort, are the changes in the breast tissue that go on with the cyclical changes in our hormones, with our ovaries making different levels of estrogen, progesterone, et cetera. And that activity, most girls are going through puberty these days in the 11, 12 age range. And the average age at menopause in this country is about 51. So we have all those years of ovarian activity, which drives breast potential discomfort. So that's the most likely cause. Now, there are some very simple things that women can do to minimize getting breast discomfort. One of them is really simple. And it's a bad thing for me to say, but caffeine makes a lot of women have sore breasts. Now, caffeine does not make women have breast cancer. That's probably the most important thing I can say here. Is so if you say, I really like that cup of coffee, that gets me what's going on in the morning, or I need 2 cups of coffee in the morning to get me going, and I want the high test, not the decaf. That's fine. It isn't going to give you breast cancer. It may make you have sore breasts. But the key thing is, I say to my patients, if you say, hey, I don't mind the sore breasts as long as you tell me that is not representative of breast cancer, I'll put up with that because I really like the caffeine. If somebody comes to me and says, Mary Jane, my breasts are killing me, I'll say, well, let's see if we can cut down on that caffeine because I might make your breasts happier. So that's one thing that I would emphasize to women, and it happens to lots and lots of people. The other thing that I have is I call it my breast cocktail. For women who have sore breasts, particularly as they get towards their periods and the breasts are more swollen and stuff like that, that I tell women that one of the components of the cocktail is trying to minimize your caffeine intake as best you can. But a combination that does seem to help is a combination of vitamin B6, pyridoxine, in the tune of about 100 milligrams a day. You don't want to take too much because then you get into nerve problems, but 100 milligrams a day is not a problem. And that seems to actually reduce breast swelling. And it also has an action on one of the hormones from our pituitary gland, which can stimulate the breast, and it tends to diminish that activity. So there is some science that that's based on. Vitamin E, about 200 units, can be very helpful for sore breasts, and this is on a daily basis. And that we really don't have any real scientific idea why it really helps. But we do know that it can be very helpful. And the third component in my breast cocktail that I tell people about, it sounds sort of weird, it's evening primrose oil. The extract from the primrose plant. Now, some of my people think you have to rub it on the breast. No, swallow it. Don't rub it on. But a couple of capsules of that a day, and the standard capsules are 500 milligram capsules, that a couple of capsules of evening primrose oil can be very helpful for sore breasts and really make them a lot more comfortable. How it works, we think, this is a theory, that it probably works through helping fatty acid metabolism, that it really does help some women that way. We're not exactly sure. But a cocktail that seems to work well for my patients is a little B6, a little vitamin E, some evening primrose oil, and keeping their caffeine down. Seems to work for a lot of my patients. So I encourage them to do that. The other trick about caffeine that I'd like to share with folks is that, and this happens during the summer a lot, is when I ask somebody how much caffeine is she getting in, and she'll say, maybe 1 cup or something like that. But I've learned to ask in the summer, and how many cups of iced tea or iced coffee are you getting in? And they'll say like 6. I'll say, okay. And it's like putting in the ice cubes does not make the caffeine go away. So when you're thinking in the summer, don't forget to include your iced tea and your iced coffee. And also colas, can have caffeine in them too. So, and chocolate, very nice, but has caffeine. So I get a lot of sore breasts around Valentine's Day,
Wow, yeah.
Oh, it's true. So anyway, so those are just some simple things to make, women who are not, these are not breast cancer issues, but they're just comfort issues, but they can be very annoying for a lot of women.
They can. And I think, Dr. Minkin, I'll say many women that I know personally, we've had the wrong idea. Again, one of the myths that you just brought to the forefront, which is so important to know, is that pain is not always associated with any form of disease necessarily in the body or cancer in the body, as much as it's just discomfort that can be alleviated through the breast cocktail, which I've never heard of, which I think is fantastic. And I really
I hope it helps.
Oh my goodness. And you should bottle this up and take this around the world, because that is something so valuable. Again, what we're always looking for is resources, right? And we don't always know the right questions to ask when we're at the doctor. So it's very helpful to hear that there are alternatives to medicine, that these are just practical resources that we can include in our regimen to help support our health. But also, one of the questions that you asked, which was so critical, that I don't think I've ever had anyone ask me about other forms of caffeine. We definitely, I've seen on the questionnaire about coffee. I've seen maybe chocolate. But when you say sweet tea, and as a Southern girl, I happen to know that in the South, it is the number one drink of the South, but it makes a big difference. And that disclosure of that one line can make a huge difference in how much, so how many solutions you can get at your appointment. So that's so helpful.
Well, thank you.
Very helpful.
So that's, again, as I said, it's not cancer that we're talking about there, but we're talking about discomfort, and that's very important, I think.
Absolutely. So when we get into, the ugly of cancer and breast cancer specifically, can you give us a little bit about what your experience has taught you, what you've seen in women, what's true and what's trending, and what we can kind of adjust in our habits?
Sure, absolutely. And, everybody, I think I should everybody, but many people are aware of what we call risk factors for breast cancer. What can raise your risk, what can lower your risk, and stuff like that. And some stuff we can't control, but there are things we can control. Okay. So one of the things, for example, we can't control is, we can't stop our family history. We're born who we are, and we have our parents and our grandparents and things like that. Now, knowing your family history is helpful. Because that can help your healthcare provider, counsel you on risks and things like that. But as far as we can't really change it. Now, there are certain, things that are transmitted genetically. And the other thing that, of course, that I really think is important for our listeners to know is there's family history and there's family history. So, I have many patients who come in and say, I have a very strong family history of breast cancer. And I'll say, well, tell me which of your family members had it. Well, my cousin, who's my third cousin, twice removed, Susie, had breast cancer. And what I have to say to people is I obviously feel very sorry for your cousin, but that probably doesn't have a huge effect on your personal risk of getting breast cancer. What we really want to talk about when we're talking about family history and risk of breast cancer, what we call first degree relatives. And what a first degree relative is your mom, your sister, or your daughter. And if one of those shows up with breast cancer, that counts as a first degree relative with breast cancer. And then and the other thing, when you're talking about family history, a lot is important whether relatives are on the same side of the family, on mom's side of the family, or on dad's side of the family. So, for example, if your dad's sister had breast cancer, that certainly is relevant. And if your mom's sister had breast cancer, one of her sisters, that's very relevant. But it's not as very important, say, as far as a genetic risk, as if, say, your mom had two sisters who had breast cancer. Both of your aunts are on your mom's side. Because that says, that gives more of a smell of genetic factors going on. So that's just something when you're getting your family history and stuff like that, you want to know it. Try to write down who in the family had it, was on your dad's side or your mom's side, so you can help your caregiver calculate out your risk. There are also certain ethnic groups that seem to have a higher risk. And for example, women who come from an Ashkenazi Jewish background seem to have a higher risk. In that population, there seems to be a higher risk of breast cancer. So knowing your background, that way can be very helpful. So if your mom was Ashkenazi Jewish, Ashkenazi Jews, that's helpful trying to figure out your genetic chances and stuff like that. The good thing, though, that we have these days as far as genetic history is that we can actually learn about it very, very easily these days. Genetic testing is regularly available. And the cost has come down dramatically in the last few years so that it can be done. And, talk to your healthcare provider. And if there is this history, family history to say, gee, as I say, if it's third degree cousin Susie, probably you wouldn't have to worry about it so much. But if your mom had two sisters who had it, that becomes much more relevant. As far as discussing with your healthcare provider and should you do genetic testing or not. So that's one thing we say can't help our genetics. One other thing that we can help, but I wouldn't advocate this, is we do know that women who have kids early in life tend to get some degree of protection on breast cancer compared to a woman who has her first child, say, when she's 40 years old. Now, I'm not going to tell you, though, that's a reason to go out and have a kid and say, well, I want to reduce my risk of getting breast cancer, so I think I'm going to have a kid now that I'm 18. Well, there are a lot of good reasons to have a kid, but I don't know that that's a good reason. We can
Definitely
do other things to help you.
Yeah.
Exactly. But that's important, as far as figuring out your risks and things like that.
Yeah.
Because, again, when you know risks, one of the things that's going to help you to figure out is when should I start doing mammography? Should I do mammography early? Should I do mammography standard time? So getting a family history can be helpful that way, just as far as detection. So those are things, in a sense, we really don't have control over. However, people like to have control over certain things, and there are certain things that women can control, which they really need to know. And one thing that most women do not know is that alcohol is not good for your breasts in general.
Wow.
And drinking one glass of wine a day actually probably is a good thing if you look at your overall health risks, because like one glass of wine is good for your heart health, maybe not fabulous for your breast health, but not bad. But once you start getting into 2 or 3 drinks a day, not great for your breasts.
Wow.
So if somebody says, how can I help my breast cancer risk? Well, let's make that 2 glasses of wine 1 glass of wine. And the other thing that plays into that extra glass of wine, wine's got calories. And that when, people, and we're going through I can't lose weight. Well, let's talk about how much, wine are you drinking?
Yeah.
And for example, 1 glass of wine is about 150 calories in it. Oof. So if you're drinking 2 glasses of wine a day and we say, well, let's see if we can cut it down to 1, not only are you getting it down to a much better risk for breast health, but you'll also lose weight if you get rid of that second glass of wine. And this is the thing that many people don't realize, is that being overweight contributes to your risk of breast cancer.
Wow.
So And the other issue that's not clear, and I won't say I know the answer for sure because we don't know it yet, but exercise may be an independent factor for breast health as well as overweight. I mean, certainly exercise to lose weight, and that's terrific. But exercise may seem to have some extra added benefits for breast health that way.
Wow, this is also vital. One other question, we talked, or I heard you mention, if there's a woman in your family who has breast cancer and the risk associated, but what about if there's a man in your family?
Very important. And thank you much, Sybil, for bringing that out. That's really important because that a significant number of breast cancer in men is associated with what I call funky genes. That, you can get some, like the BRCA mutations, BRCA people call it, that can be significantly associated with, with the BRCA gene. So especially if you have a male in the family that's a close relative, please let your healthcare provider know about that.
Wow. Okay, lots of notes are being taken right now. I can feel it because I'm mentally jotting. Go back and replay and listen to this and ask this question.
Thank you.
Yeah, there's a lot of great information here. And I'm just curious, Dr. Minkin, when we go into the doctor's office, and you've seen this over 35 years you've been practicing, you've seen women come in asking questions, maybe the wrong questions, maybe the right questions. What are some of those key questions that you've experienced that you feel can be like a lifesaver or even change the trajectory of a relationship with your doctor?
Well, I think some of it's questions and some of it's information that you can convey to your doctor about like your family history and things like that. Also your, history of pregnancies, for age at first birth, first date, how old were you when you had your first child? That's valuable information for a doctor to have because again, I seem to be saying, and I don't mean to convey this way, are things that we don't have control over, but that one thing we do have control over, if somebody's got a lot of risk factors, and we do genetic testing, and the genetic test says something funky is going on, there are things that can be done to reduce our risk of getting breast cancer. And so we don't have to say, okay, this is my risk, this is what I got to put up with. No, okay, there are things that you can do. So, for example, that let's say, you're at increased risk for breast cancer, and it's calculated out. And we actually have a lot of fancy formulas that we can use to model and actually predict what one's risk of breast cancer is based on family history, genetic testing, things of that nature.
Wow.
There are actually things that one can do preventatively. I mean, certainly the most radical is, and we see this among some of our BRCA patients, BRCA folks, that they will even do a preventative mastectomy. A prophylactic mastectomy. And that's sort of, the extreme end. And there are people who do it, and God bless them. And, and many women will do very, very well with that. But the key thing is you don't have to go to that extent. As far as knowing risk, where is that helpful? Well, one thing that will help as far as is diagnostic testing. When should you have your first mammogram? How often should you do them? Should you be supplementing with something like an MRI? Which is a fancier test, but if certain women have certain high risk, genetic traits or something like that, you may be recommended to have MRIs on a more frequent basis because that may pick something up very early. And if you're at very high risk, but you say, gee, I really don't want to have a mastectomy, that may be something that would be a valuable adjunct for you. And the other thing that women need to know is there actually are medications which can reduce your risk of getting breast cancer. So let's say you have, you're a BRCA person, and, you really don't want to have anything like a mastectomy. And you say, okay, I'm going to go for my mammograms or MRIs when folks tell me to do it. But is there anything else I can do? There are medications available that can reduce your risk. For example, one medication that's very widely used is a medication many of our listeners are aware of, something called tamoxifen. And tamoxifen has been used for many years as far as a treatment for women who've had breast cancer to prevent recurrences. However, it can be used preventatively. If somebody's at high risk, you can take it. There's another drug, which is a sister drug of tamoxifen called roloxifene, which is also used as a preventative drug. So there are medications which can be used preventatively, which is a good thing also. So I think knowing risk, even if you say, well, I certainly am not into doing something like a mastectomy, so I'm not going to check my risk. Well, the key thing is let's find out how often we should be doing testing, and maybe you want to consider medications that might reduce your risk. So there's a lot of things that we can do.
Wow. And this is so much of why we have to make sure we're in really great hands when we are at the doctor, and kind of really, really trust to ask the questions. And what I'm also hearing, great girlfriends, it's really important to be vulnerable with your doctor, be, as honest and as truthful as possible, so your doctor can have enough information, even those things that kind of feel shameful sometimes. Maybe it is, early pregnancies or miscarriages or things that, have been unsettled emotionally, but can really help your doctor, create a routine and create, solutions for us. So that is really, thank you so much for that, because that's also a good reminder. And it brings me to my next question. With this year, Dr. Minkin, so many people have found themselves without health insurance and are going the DIY route, which is do-it-yourself health. And, heading over to Dr. Google and, we've got all kind of articles, and I'm sure it probably drives a doctor wild to see some of the things that are out there on the internet. No shade to Google, but how do we locate the most reputable or reliable sources for information while we are in the middle of figuring it out?
Well, Sybil, you're asking excellent questions, and let's put it this way. I'm hoping certain things will happen here shortly, that we will have our affordable care continuing. Let's put it this way.
Yes,
we really, really, really hope for that. So not revealing any political persuasions here.
At all.
let's really, really, really hope for that.
Yes.
So, but what are the reliable sources out there? Because you're absolutely right. There's a lot of, unfortunately, junk out available online. I mean, it's a platform anybody can say what he or he wants. And what do you check as valid information? Yeah. There are some valid links. Let me give you some links that I think that are helpful for you. The American Cancer Society has a lot of excellent information on there. And so the American Cancer Society, I think, is a good resource that people can have access to. You can also call, the offices of the American Cancer Society if you really say, I need some help and stuff like that. And they can give you some guidance. So as I said, the American Cancer Society is an excellent organization that way. From the gynecological perspective, there are a few organizations out there. The American College of OB-GYNs, ACOG, ACOG.org, is our organization, our national organization. And there's a lot of information for patients on ACOG.org. So you can go to that, plug in breast health, and there's a lot of guidelines that our, experts in our field will come out with. So I think that's a valuable resource. Another resource for our older listeners is menopause.org, which is the website of the North American Menopause Society. And we are very concerned with breast health issues. And there's, again, a lot of information on there for lay audiences. So menopause.org is another, good, reliable source out there. So I think those are some basic sources that can be very helpful for women to go to get some helpful information. Another organization that's out there that deals regularly with breast health is Planned Parenthood. And Planned Parenthood does probably more screening for breast disease than most organizations. And so they're out there. And if there's a Planned Parenthood near you, you say, geez, I need some help and some questions, call your Planned Parenthood. They'll be able, if they don't have information right there, they'll be able to give you some guidance within the community as far as who to talk to.
Those are awesome, awesome, awesome resources. Okay, this is my very last yet very important question for you, Dr. Minkin, which is around, women. We tend to rally around information, and we also tend to, exclude information when we kind of feel, we want to keep it private. But I believe that friendship is a center point, and it should be an intersection of our health and wellness journeys as well. And I'm just kind of curious, if you've ever seen, and this maybe you've never, in your 35 years, maybe this will be the first time you'll see it this year, but women come in and as a group, or women come in as in friendship duos to come and have their annual appointments, or have you seen women kind of rally around each other in their appointments and kind of making it fun or making it inclusive so that, we don't have to do this thing alone?
Absolutely.
You have. That's great.
Yes.
I love it.
we do not. And that was actually going to be my next point that even if you're not going to have your exams at the same time, and that may embarrass you or whatever, that it's good to bring a friend with you, because going to or a family member, and I'll tell you why different ones may be different there. But having a friend with you is very helpful, because again, going to the physician's or nurse practitioner's office, a medical office, can be stressful, period. It just can be stressful. And having a friend with you can embolden you to ask questions that you might not normally, or that she may be able to say to you, Susie, you were going to talk about this, we were going to talk about this. Well, I was sort of embarrassed. No, but your friend can kick your butt and say, get talking about it. So
that's right.
That's something that's very good. Also, writing down notes in advance can be very helpful, because sometimes when you get nervous at a visit, you'll forget things. And so having notes is good, and having one of your friends with you to remind you, you wanted to talk about that can be very helpful. Another thing, though, about bringing, sisters with you, bringing your relatives, is that, for example, if you're talking about family history issues, your sisters are just as interested as you are, in these conditions. And, somebody may be a tad more, maybe one of your sister's kids or something like that. But family history involves everybody. So it's good to have family members there. And also you can answer questions for each other, something somebody may have forgotten to ask. And the other thing is your siblings or relatives are also interested in how does, your mother's situation affect me? That kind of thing. So I think having relatives to discuss genetic issues is a very good idea. And because the information affects everybody, and, and love each other. Presumably, I hope so, that, you're there to help each other. So that I think bringing a friend, bringing a sister are all excellent ideas. And I'm always happy to have, the whole gang. Anybody wants to come? Yeah, you betcha.
I love it. Yeah. And great girlfriends, remember, that's what friendship is for. It's for that safe space and that accountability. And I think that what's so great, one of the things that I'm really grabbing from all these incredible interviews that I'm doing through Healthy Women is that most doctors really want to play in that friend space, the support, as friendly as possible, to create allegiance for you, so you don't have to journey through the hard things and the good things alone. It can be a celebration. And if there's breakthrough, there needs to be breakthrough. There can break through together, but that you never have to have a isolated experience. And if you are, it's probably not the doctor for you. There are doctors out here, such as Dr. Minkin, who want to, stand in that really special place of a loyal, devoted, loving, kind, considerate doctor that I would love to have you as my personal doctor.
Oh, thank you so much.
Okay, so last but not least, if you have a woman who, one of your patients that is dealing with issues with breast health, what is one affirming statement that you would share with her for her journey?
Don't be afraid. That would be a very affirming statement to me, that even if somebody's diagnosed with breast cancer, let's say worst case scenario, and that's women's worst nightmare. Okay. The vast majority of women are going to do very well. And, you want to get good therapy, you want to get kind therapy. And, you want to be the level of aggression that you want to be is very important. You want to be with a caregiver who's, believing and listening to you as far as how you want to proceed. But for example, there are some astounding things that are out there. For example, if you have a very, very early breast cancer, something called a carcinoma in situ, some people aren't even operating on those folks these days. They're watching them. And so, there's some trials going on about that. So there are a lot of exciting things going on that, you may say, oh, this is doom and gloom. The other thing is that you don't have, it used to be in the old days that, oh, you have a breast tumor, you have to have a mastectomy. The answer is no. That the majority of our surgery that we're doing these days for women with, early breast cancers is we do lumpectomies. And you know what? That in many situations, in most situations, to be honest, that a lumpectomy probably is just as successful cure-wise as a mastectomy.
Wow.
So that, oh my God, I've got breast cancer, I'm going to have a mastectomy. No, that, and indeed, to be honest, one of my best friends is a breast surgeon, my friend Dr. Chris Zarfus up in Hartford. And she goes crazy because so many of her patients come in, I have to have a mastectomy. And she's like, no, I really want you to have a lumpectomy. You're going to do just as well. And they don't believe her, and she pulls out the papers and she shows them data. And that, so really, you don't have to do terrible things to folks.
Yeah, that's so good. Oh, so good to hear. So empowering. I love that. Love those affirmations. I am going to make sure that everyone can keep up with you, Dr. Minkin. Where can they connect? We've got MadameOvary.com.
Well, MadameOvary.com is a website that I hope has some information on there. And of course, the other thing we neglected to mention, Sybil, is of course going to Healthy Women is an excellent source also.
Always.
Because Healthy Women always has lots of information about all sorts of women's issues, so including breast cancer. So we can't forget that in discussions here. So as I said, but and I hope Madame Ovary helps folks to learn some hormonal stuff too.
I love it. I love it. Thank you so much, Dr. Minkin. You've been amazing. Great girlfriends.
Hardly.
Feel free to send her a ton of love at MadameOvary.com and just make sure that you're keeping up with these articles. It's super resourceful. Lots of helpful information to help us navigate our breast health journey. Thank you so much.
Thank you so much, Sybil. And I hope to all our listeners, stay well, stay healthy, and do some good things. And don't panic. Don't panic. There's nothing to panic about.
Absolutely. Don't panic. I love that. Thank you.
Great girlfriends, did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast, into the community. Speaking of community, make sure you join our Facebook group, The Great Girlfriends. You follow us on Instagram at The Great Girlfriends and on Twitter at @the_great_GFS. Last but not least, we'd like to thank my amazing husband, Kwaku, Sam and Dilly, and all of you for being a part of the global community that makes us so strong. Please remember to share with your friends. Keep listening and keep being a great girlfriend. I'm Sybil Amuti, and I'm out. Peace.